Hi everyone, I'm Dr. Senthil Kumaran, and welcome. Today we're doing something really important. We're going to build a mental GPS for one of the most common procedures out there, a safe cholecystectomy. Forget just memorizing anatomy, we're talking about building a real 3D map in your head, using some unforgettable tricks that create a safety net for you and your patient. So, let's get started.
Look, the stakes here are incredibly high. Laparoscopic surgery isn't just a video game testing your hand-eye coordination. No, it's an exercise in navigating complex 3D anatomy entirely in your mind. A wrong turn isn't just a detour, it's a straight shot to a major complication. This mental map we're building, it is your first and honestly, your most important line of defense.
So how do we actually build this internal GPS? Well, we're going to do it together, piece by piece. First, we'll establish our home base. Then, we'll identify the main highways you have to know. After that, we'll find the critical signposts, and we'll wrap it all up with a final systems check before you make any big moves.
Every single journey has to have a starting point, right? In a cholecystectomy, that means finding the one safe plane to begin your work. This is your entry point, the place that's going to keep you out of trouble from the very first second.
Our journey starts right here, at the cystic plate. Now, this isn't just some random anatomical feature. You got to think of it as the fibrous landing strip where the gallbladder is securely fastened to the liver, sitting right between segments 4B and 5. This is your home base. It's the one plane where you are always supposed to be.
And that brings us to our very first memory hook. It's super simple. Just remember this. IV the plate equals safe gate. Seriously, as long as your dissection stays right on this plate, you are in the safe zone. The second you wander off it, you're risking entry into that dangerous territory where all the major vessels and ducts are hiding.
All right, so now that we're through the gate, let's move to the next part of our map. We're approaching the main drag of this whole area, a structure that holds the most critical pipelines that we absolutely cannot afford to damage.
And this is it, the hepatoduodenal ligament. This isn't just a piece of tissue, it's the main highway of life because it contains the portal triad. Getting your orientation here is completely non-negotiable. Misidentification in this spot is the root cause of most major complications, period.
So how do we stay oriented in such a critical area? With our next mnemonic. It's a simple three-letter chant, RLP. You should make this a ritual, something you do every single time you approach Collat's triangle. It's just a quick rhythmic check that grounds you in the anatomy that's right there in front of you. Let's break down what RLP actually stands for. R. The common bile duct is to the right. L. The hepatic artery is to the left. And P. The portal vein is deep or posterior. R. L. P. It sounds simple, and it is, but it is absolutely life-saving. Okay, even with a great map, you still need a North Star. A landmark that's so reliable that if you can find it, you can always figure out where you are, no matter how confusing the view might get. This is our critical signpost. And that signpost is Rouvier's sulcus. Listen, if you only take one thing away from this whole explainer, let it be this. It's a small cleft on the liver just to the right of the hilum. Sometimes it's obvious, sometimes it's subtle, but finding it, that's everything. It tells you where you are, and even more importantly, where you absolutely must not go. And here's our next crucial memory hook that ties the landmark to what it does. The sulcus shows your route. I want you to think of it not just as a landmark, but as a line in the sand. It is the definitive boundary between the safe zone and the danger zone. So what's the bottom line? It's this. Your dissection must always stay above and anterior to the sulcus. Why? Because the common bile duct is lying just below and posterior to it. Crossing that boundary, dissecting below or behind the sulcus, is taking a direct path to a bile duct injury. It's that simple.
Okay, so we've got our landmarks, we've got our mnemonics. Now, let's pull it all together into one final pre-flight checklist. This is that quick mental systems check you can run through before you clip or cut a single thing.
I like to call this the consultant's shortcut, or simply the 3 R's. Run through it every single time. First R, Rouvier's. Ask yourself, have I found the sulcus and am I staying above it? Second R, right pedicle. Am I actively avoiding the right portal pedicle? And the third R, RLP order. Have I confirmed the right-left posterior arrangement? If you can answer yes to all 3, you are ready to proceed.
And just like that, our mental map is complete. Let's lock it in. You enter through the safe gate on the IVV plate. You navigate the main highway by chanting RLP. You follow the route that's defined by the sulcus, and you use the 3 R's as your final compass. That right there is the foundation of a safe procedure.
Now, I've got one last trick for you.
Anatomy shouldn't just be something you read in a textbook. You really need to feel the 3D relationships. And this simple model, it's just fantastic for teaching junior colleagues because it makes something abstract feel totally real and tangible.
Get them to make a fist. The surface of their knuckles? That represents the cystic plate. The crease where the thumb meets the palm? Well, that's Rouvier's sulcus. And that space between the thumb and fingers? That becomes the hepatocystic triangle. All of a sudden, the map isn't on a screen or in a book, it's literally right there, in their own hand. It makes it unforgettable.
So, we end with this question. Knowing the map, that's one thing. But having the discipline to pull it out, to check your bearings, and to follow it meticulously on every single case, whether it's easy or hard, that's what separates a good surgeon from a truly safe one. And that discipline, that's the real surgical mindset.